What up? What up? What up? So today, we're about to have an amazing conversation with Dr. Nicole Peoples. And we're going to be talking about the COVID-19 vaccine. It's a very important discussion that needs to be had. I did a poll earlier today on Instagram and Facebook. And 70% of the people who voted said that they will not be taking the vaccine. So today, Dr. Nicole Peoples will be talking about reasons why you should be considering taking the vaccine. I asked a lot of people to send their questions in, and I got a lot of questions submitted for me to ask today. So today's conversation, we're gonna get down and really discuss what is, the COVID-19 vaccine and why we should be considering it. To think that 70% of people who voted today said that they won't be taking the vaccine. So hopefully some of those folks will be on today to get some answers to their question. I know some people are concerned, some people have thoughts, and we're here to answer those questions. So I am going to bring on
Hey.
hello.
Hey,
How
hey.
are you?
Hey, I'm great. I'm great. I'm excited to have this conversation, so thanks.
Yes. So we have some folks. We're not going to be taking people live, but we're going to be answering questions live as well. So if you have some questions, so Brandon, leave it in the comment section and we will answer the questions for you as well. So thank you for being on today. I'm very excited about this conversation and dialogue because, you know, all you hear within the community, especially the Black community, people of color, is distrust for the government, not wanting to take the vaccine. And I wanted to have this conversation today because I felt it was important for the community to be equipped with answers and have somebody who's within the industry and field to be able to share what their thoughts are, what they've been seeing, and give us some insight and information around this space because it's very important. Where we are today, it's unprecedented. This isn't something that we've been through. And this is something to be taken serious. And I don't know if enough people are taking it serious. So I think it is an important conversation for us to have today. So Dr. Peoples, I want to thank you for being here today. I'm super excited about this. And this will live past here. So I
Yes.
plan on posting this and I plan on sharing this to a lot of folks to be able to get those insights and information from you. So if you can you please just share with everybody who you are, what you do, and what to look forward to today with our conversation?
Yeah, so thanks again for doing this. Number one, it's super important that, to me, that we have faces that look like ours talking about issues that are most important to us. And so this is something that it actually, in the very beginning, when I started thinking about talking, publicly about vaccines, I was really sort of anxious about it because I too was really nervous about taking it. And but I realized that, if I'm not talking about it, then other people are going to be out there talking on our behalf, and that I don't want. So just a little introduction about who I am. I'm Dr. Nicole Peoples. I'm an internal medicine physician. I take care of patients in the hospital majority, but now I'm taking care of a lot of COVID patients. So I've been working essentially on the front lines with patients who have been intubated, who have had, severe complications from COVID. I'm also an integrative medicine practitioner. So what is weird about this juxtaposition is that I'm also the most holistic person you'll meet. I'm the type of person who doesn't like the ingredients that are in Cheerios, right? So
Right.
I'm the organic person, the gluten-free, I'm really holistic and organic in the way that I think about healthcare. And the way I am in my own life. So really trying to figure out, how to navigate this industry right now, where we're looking at a vaccine and we're looking at a disease that we haven't seen before. You know, I was very skeptical. I mean, you can ask my husband, you can ask anybody who knows me. If you'd asked me a month and a half ago if I was going to take this vaccine, I was giving people side eye, like, not me, you know. And the difference is that I can have skepticism and I can have fear, but because people rely on the information I provide them, I can't just stop at the fear. I have to add research to that. I've got to, you know, look up the questions that I have that I want answers to. And I've got to come up with concise answers, not just for my patients, but also for myself, right? Because I've got to, you know, they're setting up right now in the hospital to give me a vaccine, literally today. And, you know, I've got to decide what I'm going to do with, you know, my family. I've got to decide what I'm going to do with my grandparents and my mother and my husband's family. So it's real close to me, and not just the medical way. It's, you know, it's personal, because, you know, we all have to deal with this one way or the other.
Right. So there's a couple of different ways we could take this, but I feel one thing I think we should just get out of the way is, typically from what I've read and speaking to, you know, some other doctors as well, typically it takes some time for a vaccine to get developed and put out. But it seems as if it's coming out pretty fast this year.
Yeah.
Is it normal? Were there some steps that, based off of previous research, that allowed for us to be able to speed up the process? I think it would help and ease a lot of people's, you know, tension or discomfort with taking the vaccine by understanding the process.
Yeah. That was let me start off by saying that I think the skepticism and the fear or the anxiety about taking this vaccine is real, and for good reason. I don't want to make it seem like I am pushing anybody to take a vaccine that they're not comfortable taking. But those were the same questions I had. Those were the same things that I'm like, it takes not just a couple of years, it takes somewhere between 4 to 10 years to develop a vaccine.
Wow, yeah.
And this has happened in 11 months. And so my first gut reaction is like, you know, something's amiss. And then you add on to that, the fact that we are under the current administration, and they're adding their fuel to the fire. So you're wondering, are there political reasons why it happened so fast? And so when I went to actually figure out why this happened so fast, there is a litany of reasons, and I'm just going to sort of start from the beginning. So the first thing we have to know is that the people who created this vaccine got information about the genetics of this vaccine back in January. And what they did is immediately these are people who had already been working on a coronavirus vaccine from 2002, because we had a coronavirus before. We had one in 2002. We had one in 2012, I believe. And they were different viruses, but they were still similar in nature. And so the knowledge behind coronaviruses wasn't new. So it wasn't like we just started from scratch. And so they had a lot of information already starting in January when they got the genetic code. They already knew what a part of the virus they were going to use to create the vaccine. And they actually used a technology that had not been used and had not been fully, you know, tested for vaccines before. Now, that technology is using something called mRNA, and we're not going to get too much into that, but it is a technology that had been used in cancer patients and cancer treatment, and it was being used or developed for the SARS, the original SARS, back in 2002. So they had that knowledge, and they had already known that they could use an mRNA to make a vaccine. But back then, that virus didn't turn into a pandemic, so funding got cut. And so they didn't fully develop that technology. But now, when, you know, this virus came and this became a global pandemic, obviously resources started going towards creating a vaccine based off of that technology. So I think the first thing we have to know is that the information was not new. It didn't just come out of nowhere. And then what they decided to do was they said, well, we're going to do things that we normally did consecutively. We're going to do them all at the same time, or we're going to do them much quicker. So phase 1 and phase 2 trials and got sort of merged, and phase 2 and phase 3 trials got sort of merged. They didn't skip anything, but what they did was they said, we're going to start enrolling people in all of these things sort of simultaneously. It just cuts out a whole lot of red tape. Oftentimes when you want to get funded to do some research, you also have to get FDA approval, and that can take months. But you can imagine that this got pushed to the top of the line, so things just went a lot quicker. Now, with all that being said, you've got this sort of new technology used in a new sort of way to create this vaccine. You've got, a lot of money, a lot of resources being pushed, but that doesn't guarantee that you're going to have a good product at the end, and you're going to get a good vaccine, and that you're going to be able to go through these trials fast. So something very unique about going through this trial, the sort of the phase 2 and phase 3 trials, is that there's a lot of COVID out there. There's just, COVID is everywhere. It's unlike many diseases. If you think about HIV, if you think about even the flu, the number of cases are significantly more than a lot of other diseases. And it progresses much faster. So you're able to identify people who have the disease and people who don't have the disease and compare them. You're able to get to a high number, which is what you need. You need a certain number of patients to test, and you're able to get to that number really quick when it's really high in the population. So these studies were able to be done really quickly, because you can say, this person, I gave the vaccine to them. This person, I didn't give the vaccine. The person I didn't give the vaccine to got corona, and the person I did give the vaccine to didn't get corona. And so you're able to do that research a lot quicker. And so that was, you put all of those things together, and then you get a much quicker result.
So I think some concern that people have, so I get the process of us being able to speed it up because of previous research, and that was being done. But what about the side effects, and have we had enough time? I know you said that because the cases are at such volume that we can speed up the process or have enough subjects to do the testing, but has it been enough time to understand what those side effects could be? Maybe a year from now, maybe 2 years from now, there can be an effect that comes. Is that something we just have to live with? Or, how do we respond to that? Because a lot of people, I know recently there were some cases of Bell's palsy that came up in Europe, and some other things. So those things bring, like concern to folks. It's like, all right, this is something that's happening now, and what's going to happen a year from now,
Right. Yeah, no, I think those are valid concerns, and they're concerns that I have to some degree. There's a lot that we don't know, and there's going to be a lot that we're going to learn over time. But when, as I started to think about this, and really what I started to think about is sort of this idea of risk and benefit, right? Mm-hmm. So what we know right now is that people of color and minorities are dying at a higher rate. We know that they're getting the disease at a higher rate. They're getting more severe disease at a higher rate. We know that for a fact right now. There is a potential for minor side effects. And when I say minor, there's, swelling, there's fever, there's, even Bell's palsy. Okay. It's not nobody wants to get Bell's palsy, but if somebody did get something like that, a neurologic sort of disorder as a result of a vaccine, and this goes for any vaccine, it's rare. COVID is common. COVID is, like it's the sheer number of people who are, literally dying. I mean, one of the things that really shifted my understanding or my willingness to consider this vaccine was when I started hearing 3,000 people died yesterday. 3,600 people died just yesterday. And then 3,000 the day before that, and 3,000 the day before that. Those are real risk. And so it started to not make sense to me why I would be less likely to take a potential, rare risk over a real and present risk today. But there's also some scientific reasons why this virus may not have as bad of a side effect profile. And part of that is, again, this is a special type of vaccine. the mRNA, the actual molecule that the gene that they insert with the vaccine, it actually gets degraded within hours of you injecting it. So you put it into your system, your body develops a normal immune response, the same type of immune response that you would develop if you got coronavirus, except you didn't actually get the virus. You didn't actually get sick. So your body is going to develop this immune response, which is what's going to fight off the disease and keep you, but then that mRNA doesn't actually get into the DNA like other vaccines do. It doesn't actually cause more downstream effects. It doesn't last long enough. And so there are things that about this particular vaccine that started to make me think, okay, well, the side effect risk profile is fairly low given the nature of the type of vaccine. And then we also know from previous vaccines that most side effects that we see, the more common side effects we see within the first 6 weeks, and we well past that time. So these longer term side effects that we may see a year down the line, 2 years down the line, obviously we don't have the answers to that, but the chances of them happening are not that high. And if they did, they're going to be rare. And right now we're dealing with a very real and common, threat to not just death, but also just injury, because I see it every day. I see the people who go into renal failure, the strokes, the heart attacks, all of these other ailments that happen as a result of having the disease. I see the people who survived, and, surviving after having a severe COVID case is not great. And even for people who have mild disease, there's a lot we don't know that are going to be the long-term effects. We're seeing people with long-term effects from having COVID, and they were essentially asymptomatic or had minor symptoms. So I think we have to start thinking about what we actually know right now, and then compare the risk and benefits to what may potentially happen down the road. And so when I weigh those two things, the risk of getting COVID and having even minor side effects, long-term side effects, severe side effects, or even death, those risks are way higher than the potential risk of a vaccine.
Yeah, so I want to ask you a specific question with regards to that. But before I do, I've heard that this is a different type of vaccine. So normally, like the flu, it's sort of like a scaled down version of the flu that they give you to help your body combat that, where this is not actually giving you coronavirus, but it's a different form of vaccine.
Yeah. So basically what this is that when I talked about that mRNA, what it basically does, it's sort of like instructions on how to develop a protein. And so you give somebody the mRNA, which is, the instructions, is not even the protein. And once it gets into the body, it makes a protein, and it makes a specific protein called the spike protein, which is what actually causes the immune response in the body when you have coronavirus. So we're giving you just a piece of the virus that causes inflammation and causes an immune response, but we're not giving you the actual virus, which is very different than actually many of the other vaccines where we give you either a live but weakened version or a dead version of the virus. Those are much more, I would think, would have more potential side effects and more complications than actually just giving you the spike protein. And I was talking with someone today, and it dawned on me when we were talking, and I thought, oh gosh, the same immune response that you're going to get from this vaccine is going to be the same type of immune response you're going to actually get from the virus. So if you do have a side effect, the side effect may actually be to the actual spike protein. And you can get that if you just get coronavirus, right? So if your body has an immune response to the spike protein when you get coronavirus, it's going to have that response anyway. You're going to have some long-term complications of reacting to just that spike protein. So it's not as if giving you the vaccine that codes for the spike protein is somehow more risky. If anything, it's less risky, right? So I think you have to think, if I get coronavirus, what are the potential complications of that? What are the side effects? How's my body going to respond to the spike protein I actually get along with the virus, right? As opposed to just getting that spike protein that doesn't actually cause disease.
So I just learned this, and I don't know if it's true or not, so I'd love to ask you. With regards to people who have allergies. So I did a poll today, and 70% of the people who responded on Instagram and Facebook said that they will not be taking the vaccine.
Yes.
And one of the reasons why, somebody said that they suffer from severe allergies. And I heard that for those who suffer from allergies, that you need to consult with your doctor before taking a vaccine, and wanted to know if that was true and if there might be any effects from taking the vaccine and having allergies.
Yeah, I think that this is one of those things where a little bit of information can be kind of dangerous. And if I'm not mistaken, one of the reasons why that is because there were two cases in Europe right after they did their vaccine, that very first day when they started vaccinating people, that they had like anaphylactic response, which is it's a very severe sort of allergic reaction. And so the question is, have you ever had anaphylaxis? You know how like when you take the flu vaccine, they say, have you ever had any reaction to eggs? Because there's a component of the flu vaccine that's similar to eggs, or, you know, so what they're asking you is to come see your doctor. Let's talk about what type of allergies you have. But these aren't allergies like if you went out and, you know, got pollen. We're talking about like if you ever had a severe reaction. And then even if you have to, let's say, penicillin or some other, you know, drug, if you've ever had anaphylaxis, then we would still need to decide whether or not there's anything in this vaccine that would trigger that same allergy. And if not, we go ahead and say, yes, it's safe to give. But there are absolutely a lot of unknowns. We might find out that people with certain conditions don't respond as well to this vaccine. But keep in mind, a lot of these conditions that we're concerned about are also some of the conditions that would cause you to develop severe disease. So I know I've heard some people talk about, like, you know, if like has the vaccine been tested in people who have some of the medical problems that that African Americans have, for example, like at very high rates. So obesity, diabetes, hypertension, high cholesterol, heart disease, strokes. Those are the risk factors that put you at risk of actually having severe illness and potentially death. Those are the people who I would absolutely say, if anybody needs to take it, those are the people who need to take it, as opposed to those are the people I'm fearful of taking it. So I've heard that go around several different times, but there's no real truth to that. I'm not concerned about that as a doctor, and I wouldn't recommend people not get it because they are fearful that the vaccine would not help those people. Those are exactly the people it's designed to help.
So how are we approaching this vaccine in regards to frequency of taking the vaccine? So I know the flu, every season is flu season. So, you know, the all pharmacies are offering to take flu shots. You see all the commercials and advertisements about taking flu shots. Is the the COVID-19 vaccine something that you would take yearly? Or is this something that you take one time and you're good forever? And I've also heard that it's a two-step process. Is it a two-step where you take one shot and then you take one later on?
Yeah, so let me address the first question first. So that's one of the things that we don't know, right? We don't really actually know how long immunity lasts. So the same way we don't know how long immunity lasts if you get corona, right? So a lot of people wonder, you know, if I get coronavirus, do I need to take the vaccine? And the answer has been, you know, yes, because we don't even know if you get coronavirus today, whether or not you could get coronavirus again in 6 months. So we don't know that about coronavirus, and we don't know that about the vaccine. We don't know how long it will last. That's one of those things that we're going to learn as time goes on. Right now, we know that it lasts at least 3 months. And so some people might say, well, if we don't even know how long it's going to last, why would I put myself at some, you know, potential risk if we don't know how long the vaccine is going to hold? But again, right now, I think you're going to hear me say this 100 times. It's all about risk and benefit. 3,600 people died just yesterday in the United States of America. So if we can get this virus under control in the next 3 months where more people have immunity, then that would save lives. It would save lots of lives, thousands of lives. So, and it might save your life. It might save the life of someone you love. So I think, yes, we're going to have to take some time to get some more answers to how long immunity lasts. It may be something that we need to get every year. It may be something that has much longer immunity. We don't know that yet. As to your second question about timing, Yeah, so both vaccines, the Pfizer and the Moderna, have about a 3 to 4 week between the first and the second shot. So you're going to get one shot, and then 3 or 4 weeks later, you come back and get that second shot. And that's because we know that with the first shot, we are seeing that there is some immunity gains, but you get more immunity up to that 85 to 95% immunity at after that second shot.
Got it. So is there a big difference between the two? Is there a reason why there's Pfizer and Moderna? Is it because of, business purposes, or is there a benefit, to having two?
Yeah, there are minor differences, but the thing about both of those is they're both the mRNA virus vaccines. So there are other studies trials that are coming for, virus-based vaccines, for protein-based vaccines. So there are other technologies. Some of the technologies that we've used to make other vaccines, those studies are still being done, but Moderna and Pfizer are both mRNA. So that's why they both are almost coming out at the same time, because they were able to do it at the same speed. But I don't know that there's a benefit to taking one over the other. I think Moderna just got approved by the FDA tonight. And so I think they're going to start releasing their vaccine on the 21st of December. By the time people are going to be able to actually get this vaccine, you'll have the option of either one, and more information will be known. And if more information comes out, then, we'll, maybe have another one of these and I'll talk to you about the differences. But
Yeah.
Right now, either one should do.
So what's the process? Is it something that will be available at pharmacies and everybody can just walk in and get a shot? Or is it something because of, preconditions? And I know somebody asked about taking meds for suppressed the suppressed immune system. Is this something you need to get consulted on from a doctor to make sure that there isn't something already going on with you before you take the shot? Or how is that supposed to roll out?
Yeah, so the CDC has been responsible for determining who gets the vaccine and when. So, for example, right now, the first doses are going to healthcare workers and people in nursing homes, and then they're going to roll it out to more people. I don't, the actual rollout plan is sort of evolving, just like everything else is evolving. I mean, I was listening on the news tonight, and they were talking about, something about cutting 40% of future vaccines, and certain states are getting things at separate times. But actually, I found this. There's on the New York Times. If I wish I could remember the name of it, I will before the end of this. But on the New York Times actually has this site where you can actually put in some information, put your age, put your whether or not you have pre-existing conditions, put what county you live in, and it will actually tell you where you are in line. So give you an estimate. And so, like, I put myself in there because I'm a healthcare worker. Obviously, I'm getting the vaccine within the next 2 weeks. But and then I put some other people who I know who have risk factors, and just depending on how you answer the question, you might be you may not even have access to the vaccine until like March or April. So for a lot of those people who are saying, "Oh, I want to wait," well, you're probably going to have to wait anyway, a little bit at least. So.
So a question popped up. Now that the vaccine is available, what are some of your medical colleagues saying about it? I've been trying to get a sense, and depending on it's a long question and it's not going all the way through. But now that the vaccine is available, what are some of your medical colleagues saying about it? Guess we can answer that.
You know what? Let me tell you, people are still torn. But the reason why I think people are torn, like I had a gentleman come up to me today, and he was like, "Hey, you getting the vaccine?" And I was telling him, yeah, I was really weary about it in the beginning, but now I'm considering it. And I was, telling him, everything that I've looked up and everything that I've read. And he was like, yeah, I haven't really had that much time to kind of look into it. And what I find is that, your skepticism has to be met with knowledge, right? So a lot of the people who are still on the fence about taking the vaccine, haven't done the research, and that's fine. I'm not expecting everybody out there to go do their research. This is why I do the research, and then I try to give this information to you, and hopefully there's some, level of trustworthiness between me and whoever's watching. But
Right.
if you want to, go and see what the data is, particularly if you're a clinician, then I think that people, once they see, kind of explain the things that we've sort of talked about tonight and other details, that I think people's, anxiety levels drop a little bit. But I do
Yes.
think, there is skepticism. I do know that there are still a lot of unknowns. But again, risk benefit, is it, for a lot of the colleagues who are seeing and treating patients with COVID, they are getting it because we have a different perspective than the average person. We're literally watching people suffer and die, and so we're in the grit of it. We're not sitting here where some people can, think about whether or not COVID is real, whether or not it's really affecting us, whether, like, we see it. Like, I see my patients that are coming in, and majority of them being African American, being older with chronic illnesses. But I also had a patient who died at 33. I also had a patient who died at 42. So, it's real to me. And so I think the colleagues who are treating patients with COVID, there's no doubt.
So my question, have trials began with children? Have they been testing it on children yet? Do you know?
So yeah, I know Moderna is, I think on December 2nd, they started a trial for adolescents. So I think 12 to 18-year-olds. So there are no studies that I know of that are on children yet, just like I don't know if there's any studies on pregnant women yet. But yeah,
So is that something we should, be thinking about as well, So if we haven't, and this is just me asking, and, if we haven't gotten enough information about it yet or trials, would it be okay for, and I'm not asking you specific, just, obviously we would have to ask, our doctors, but as an example, my wife is pregnant, is that something where, it would be okay for her to take the vaccine right now if we haven't done enough trial or, error to understand how that would impact the pregnancy or the child in her or her?
Yeah.
Is that some, I guess that's some of the factors that we still need to learn,
Yeah, I think that's going to be ongoing. A lot of studies, a lot of things that we do aren't always tested in women and pregnant women, right? Because we're wondering what the risk and benefit are. And so I think even for my doctor friends who are pregnant, there's no right answer about that right now. What we do know is that people who who are pregnant tend to have more severe disease if they get it, that they tend to have maybe preterm labor if they get coronavirus. Okay, so one of the things I think is really important, and we have to operate in what we absolutely know for sure, and then we have to ask ourselves about the questions we don't quite know the answer to, right? So, and figure out, how we're going to get that information. But what we know right now is that pregnant women who get coronavirus tend to, have complications or have issues, and so when we know that there's biological probability that this type of vaccine is not going to cause problems because it doesn't get into your DNA. It doesn't cross the placenta, and so we know enough about the vaccine to know what it doesn't do. And so I think right now the gestalt about it is that the benefit outweighs the risk. But again, you would need to talk, obviously you need to talk with your doctor about it because there isn't a right answer. And I think hopefully we'll get to a chance for us to talk a little bit about sort of, why I think having these conversations are really important. But one real good reason is informed consent, right? So your wife and you are gonna sit down with the doctor, and she's gonna tell you what you know and what you don't know, and then you guys are gonna jointly make a decision based off of the information that's available. There's nobody forcing people to do one thing or another. You just have to weigh, like, is this right for me or is it not? And in the absence of having data, you're going to have to go off of speculation, but educated speculation, right? Like the things I just talked about.
So Dr. Brown said she agreed. She said, yep, 12 to 18-year-olds from Moderna they're having trials with, and moms transfer immunity to their babies. So another question that came out just now was, Are you aware of any specific side effects of the vaccine that have occurred specifically to people of color?
No, actually. So in both of the studies, I think both studies had about 10% African Americans of these two studies, but the Pfizer and the Moderna. And I think there were no real differences, and they were able to see in race between Latinx or African Americans, Native Americans, all of these sort of minority groups. So these were things that were looked at. I haven't personally pierced through the data to know exactly how many people who got swelling or fever. But here's the thing: we do know there were no major side effects that were noted. The biggest side effect that I know of is the anaphylaxis, which was treated with a little bit of Benadryl and steroids. The people who got the anaphylaxis did well in Europe. There was a case of, I think, Bell's palsy, or was it Bell's palsy? No, it wasn't. It was Guillain-Barré, I think, in one of the other trials that was a viral based vaccine, but not for this mRNA. So even of the side effects that were seen, they were all very mild, the same types of things you'd see when you get like other vaccines, like fever, maybe aches for a day. So yeah, nothing in African Americans.
So question just came up. So he says, I'm hearing the vaccine only helps to suppress symptoms. It doesn't protect you from catching COVID.
No, so interesting. That's a good question. So what it doesn't do, or what we don't know if it does, if it keeps you from giving it to transmitting it to other people, but it actually does keep you from getting it, and it can keep you from having more severe disease. So for example, I think, and I'm going to botch these numbers, I wrote them down, but of the people who got the vaccine who actually did get corona, none of them got severe disease. So for those people, if you get it, it actually keeps you from getting severe disease, and severe disease is defined as somebody who has to actually go to the hospital, may end up in the ICU, and of the people who, the majority, I guess the 95%, that efficacy rate that they talk about, 95% effective. All the other people who got the coronavirus didn't get the vaccine. So it does both, but what we don't know is whether it keeps you from transmitting it. And so that's why even if you get the vaccine, you're still going to have to wear masks. You're still going to have to social distance. You're still going to have to do those things, because we don't know whether or not you can give it. And we should have that data, within the next 6 months. We should have more data on that, but right now we just don't know.
So another question that came up, and I was going to ask something similar, so I'll kind of put it together. Do you think we'll get to a point where if you don't take the vaccine, that there'll be restrictions on, let's say, travel or going into the office for work?
No, because technically, because this got emergency use authorization in America, and keep in mind, there were other countries that just flat out approved the vaccine, like not the emergency use authorization. What that does, emergency use authorization, what it says is that it's it's technically still we're still testing it, so we're still it's still not been fully accepted as experimental. That's the word I was looking for. It's still considered experimental because it got the emergency use authorization. So you can't really force anybody to take an experimental vaccine. But here's the thing: when I say that, the first thing that comes to mind is I don't want to be experimented on. If it's still experimental, then there's still too much we don't know. And given our history in African American community of being experimented on, one of the things that I stress again is the difference is that we're being informed, and we're giving consent or not giving consent. So nobody's going to force you to get this vaccine, and you always have the right to refuse it. The question is whether you should or not, whether you should refuse it. And you get to make that choice. And I think it's important that you use informed consent. You're informed, and then you make a decision, not just, I'm not going to get it because, I've got some preconceived notions, like really inform yourself like you're doing now, and then make that decision.
So a question that I don't know if I've ever heard the answer to, or if anybody has, brought light to it or truth. If you previously had COVID,
Mm-hmm.
so if you had COVID this year, one, can you get it again?
Mm-hmm.
And two, if you've had it, should you get the vaccine since you've had it already? I guess is a question.
Yeah. So the answer to that is okay. So the answer about what the recommendation is yes, right? Can you get it again? There have been cases where we suspect people got it again, but usually they get it. If they did get it again, it's at least 6 months out. So again, that idea that you got the disease but you didn't confer long-term immunity. And so because we don't really know, like, who's going to get it again, can you get it again, when can you get it again, the recommendation is to get the vaccine anyway. The part that's, where I'm hedging is that it's just, we honestly don't know enough. I mean, we've had the disease here for 10 months now, 11 months now. So there is going to be more information to come out on that. But the standard answer right now is if you've had coronavirus, you probably need to get the vaccine again, because we don't know how long you have immunity for.
Okay. So something that has been going around is a love letter to the Black community, where Black doctors are basically, just, expressing the urgency and I guess the recommendation to take the vaccine. For those who might be on the fence right now, is there something you want to share or say to kind of, if they're on the fence, kind of get them on the side of understanding that they need to take this vaccine, especially
Yeah,
within the Black community?
I mean, I'll say a couple of things to that. So the first one is that is the same thing I've said before. The real like, I really want people to think about the risk of not getting it, and think about it in terms of not just sort of what the numbers on the news channel are saying. Think about it in terms of your household, and I mean that's really one of the things that also pushed to me is that I'm not really concerned that I'm going to have a long-term effect, or I'm going to have severe disease, or that I'm going to die. I honestly don't feel like I'm at risk for that. Just given that I'm healthy, I'm young. And so I think that's a real sense of protection, right? The thing that I'm concerned about is the fact that I have a mom who comes, that lives right down the street from me. I have parent-in-laws who, have comorbid conditions. And there are people that I'm going to come in contact with between now and the end of next year that I very well could be the reason they get COVID and have severe disease or die. People I physically know. And so by me protecting myself, and, even though I said that we don't know enough about transmission yet, about whether or not I can give it or not, it's still very important to me that I do what I can to protect those around me that I love. And so I know a lot of people are thinking to themselves, well, I'm young, I'm healthy, I'm not going to take this sort of experimental vaccine. I was in that same camp with you guys. But one of the things that sort of shifted for me was this concern for those people around me. The other thing that shifted for me was this idea of long COVID. So if you haven't heard of long COVID, it's this sort of side effects of COVID. So people who get, mild disease, but then they end up with fibromyalgia type symptoms, with fatigue and brain fog and, just very, weird pain, respiratory issues that last, 6 months or even longer. We don't know what these long-term effects of having COVID are going to be. And I don't want that either, right? So when we talk about what I'm most fearful of or what I'm most concerned about, I'm concerned of, hurting someone else, but I'm also concerned of the side effects of COVID, which we do know are in fact real, and we have evidence for right now. So those are the first two things. The last thing I would say is, I also think about what was the point of, us fighting for civil rights, right? Part of us fighting for civil rights was so that we could have access and that we could have informed consent. When you think about the Tuskegee Institute, the Tuskegee experiment on men where they were given syphilis, then penicillin came. And they didn't have access to penicillin. And so they were just allowed to have syphilis and not be treated for it. Imagine if that were today, where we had coronavirus. It was affecting Black and brown people more than anybody else, yet they were only giving the vaccine to white people, right? So we fought to be able to, if there was a situation just like this, that we would have access to that, to the vaccine. And so that on top of that, that we would have informed consent about it, right? So not only, the other problem with the Tuskegee study was that these men didn't even know they were in a study, right? So the government was experimenting on them, and they didn't give informed consent. They didn't know what was happening, and they didn't give consent for it. What we have an opportunity to do in 2020 is to, number one, have access to the highest quality medical care, at the same time of being able to make a decision about whether we want to have it or not. And that's what we fought for. And when people are concerned about sort of, our really, hardened history within this country and what the medical community has done to African Americans, I just want to remind people that, this is exactly what we fought for. We didn't fight because we think that people are, always going to take advantage of us. We fought to have access to this. And so, I mean, I don't know if that's enough for people, but those were the things that moved me.
All right. So I have two scenarios I want to ask. But before I do, my godson's in here and he has a question. So I want to show him some love. So he's in high school. He just scored, 13 something on his SATs. He's amazing.
Congratulations.
So love to you, Brandon. He asked, have recent studies touched on how it affects different age groups, or if it is even an issue at all? Because I know in some areas, like if we go into a building or go somewhere, they'll say, if they're under 3 or 4 years old, they don't need a mask. Older, they need a mask. And it's kind of like segmenting. And I'm like, well, has there been enough research or study to show that these toddlers or, can be impacted by it? So I guess, has there been any research or information that's come back on different age groups and the impact? Obviously, the older, preconditioned, such, that can be an impact. But as you get younger and younger, what does that look like?
So good question. And is the question about coronavirus or about the vaccine?
Coronavirus.
Yeah. So this is what we do know. And this is some information that I'm just sort of, kind of thinking about because my kids are out of school and there's this big issue about, should kids go back to school? And so I've been hearing a lot of people saying, well, kids aren't affected as much as older people. And wondering, what was it about kids that made a difference? And so some of the studies have shown that actually kids have, some of them will have a built-in immunity to coronavirus, surprisingly. And that's because they've been exposed to so many. So there are different parts to coronaviruses, but I'm trying not to get too technical, but there's something called the S2 protein that's found on other coronaviruses. And that S2 protein is also found on this coronavirus. And so their immune system recognizes it and fights it off the moment it sees it. And so we're finding that younger kids, particularly, less than 12, tend to have a higher degree of immunity already. And so they're not getting it as much. We also have seen that they don't transmit it as much. So kids are less likely to give it to other kids. They're less likely to give it to adults. So we do know that there's a level of protection. But I think, initially the reason why people were saying don't put masks on toddlers was because everybody knows that toddlers aren't going to wear their mask. And no matter how much you try, that's probably not going to happen. But if everybody else is wearing their mask, remember, we're thinking about how do we exist as a community. If everybody else is wearing their mask, then maybe, it's not, as bad if your 6-month newborn doesn't have their face covered.
Got it.
But there is some protection, I think, the evidence is showing now. Yeah.
And I'm pretty sure he's asking because he is a high school student. He
Yeah.
probably wants some ammo to use against his parents of why he should be able to go meet his friends. So how
Oh,
about
well,
like in
no,
that
that's
high school range?
no, no. So that don't let me mislead you, son. So you are still going to need to wear your mask. We all need to wear a mask. Gosh, you know, the research is showing literally if we just wore masks, like if we did nothing else, we didn't wash our hands, we didn't socially distance, if we just wore our mask, we would actually decrease this the transmission of this disease to almost, you know, minimal numbers, right? And so there's no excuse right now for people, I don't care who you are, you know, not to wear a mask unless you're a toddler. But, you know, I also think that, you know, really have to think about, you know, you go out as a teenager and then who do you come home to, right? Like, again, you're not concerned about your life. You're not concerned about whether or not coronavirus is going to kill you. But I'm wondering, like, I'm always, even now, I'm just thinking, who are the patients who were coming into the hospital? Like, who infected them? Because a lot of them were like, I stayed at home, I didn't go anywhere. But somebody came in their house and didn't have their mask on and was, you know, exposed them. And so, you know, until we can get these numbers down, I just think we have to be a little bit more responsible. And here's another thing I guess I wanted to talk about was this idea that, you know, I'm not going to take the vaccine, but I'm not going to wear a mask either, and I'm not going to do anything else to improve my health, right? Like that is also just like mind-boggling to me. If you decide that you don't want to get this vaccine, I will support you, and you know, you are entitled to that. As long as you had informed consent and you consented not to do it, I am okay with that. That is your human right. However, with that, you also need to take responsibility for the fact that, you know, the virus is still here and it's killing people. And maybe you should wear your mask and wash your hands and remain socially distanced and do all of those other things. You should be taking your vitamin D and you should be eating well and, you know, avoiding fast foods and avoiding things that decrease your immune system, like high sugary foods. There's a lot of stuff you can do if you choose not to take this vaccine. But to not take the vaccine and not do anything to protect other people is just irresponsible.
Okay. So my scenarios, two scenarios, looking into 2021, what does good look like? If every, you know, good amount of people take the vaccine, what does that look like for us
Mhm.
as a society moving forward? Because right now restaurants are closing back up in New York, and it's tough. Um, if everybody's taking the vaccine, how soon can we get to some sense of normalcy? That's scenario one. I'll get to two after you
Okay.
answer this question.
Well, I don't know the answer to that. But what I
Okay.
can say, because it's really going to depend on how many people get the vaccine. It's really going to depend on how many people wear their mask. I mean, I'm not super hopeful right now, only because even if, you know, if 50% or 60% of the population get the vaccine, that number one going to take a couple of months for us to roll that out. But the issue is that people aren't doing the easy thing, right? Like that's the part that's blowing my mind. Like even before we got to vaccines, we had a solution. We had a solution back in March. We knew what we needed to do. People just chose not to do it. And so, and that thing is, just if anybody didn't just hear my last other rant, but it's wear a mask and stay at home. You know, like where are people getting coronavirus? They're getting it at restaurants. They're getting it at bars. Those are the most likely places for you to transmit this disease. And that's because you don't have your mask on and you're within proximity, 6 feet of another person for longer than 15 minutes. So
Mm.
that's where people are getting it. If as a society, we decided to close down restaurants and indoor eating, and everybody agreed to wear masks, none of this would have happened. All these people who were died yesterday would still be here. That's how serious this is. And I think people were going to die of coronavirus. This many people would not have died if we had just done the right thing early on. And so when we talk about what is it going to look like, it really just depends on y'all. You know, it depends on all of us. It depends on whether or not we're willing to wear our mask, even if we get the vaccine. It depends, you know, it doesn't even, I mean, to some degree, it depends on how many people get the vaccine. But when it gets down to it, we still don't know if you can transmit it if you have the vaccine. So it really comes down to people doing what we should have been doing all along. And we just have to start, you know, if we don't do that, 2021 is going to look similar to 2020.
So that was going to be my other scenario. Is there a possibility that we can hit the reset button and go back to February, March of 2020 of lockdown everywhere, everything's closed, people not really leaving their homes? Like, is there a possibility of us getting there if people aren't wearing their mask and doing what they're supposed to be doing?
If that's going to happen, it's going to happen in the next 6 weeks.
Mm.
This is bad, and I knew this was bad back in March when they said it, because I kept saying, I know what the hospitals look like normally in January. Normally we are to capacity. We have more physicians on staff. And the issue is the fact that people are sick, and it is the fact that people are, like, the number of people who get the disease. But really the issue is whether our healthcare system can handle it. That was the reason why we had the shutdown the first time. And what we're seeing in California right now is disastrous. I'm hearing that they are increasing the number of patients that nurses are having in the ICU. We have nurses who are ER nurses coming in and doing, ICU work. I mean, it's bananas. It's not even just the people who are going to, suffer because they got corona. It's the person who just was going to have a heart attack on January 5th, went to the emergency room and had to stay in the emergency room for 3 days because there were no beds in the ICU, and there was no, there were no physicians or nurses to care for them. So it's bigger than just coronavirus. It's about how our healthcare system can manage. And, people are, doctors and nurses, we're at a shortage. Not because there aren't enough doctors and nurses, there are just too many patients. And so the lockdown is going to be determined by what the hospitals are looking like and what we are capable of handling. But also, I don't think that anybody's going to, for political reasons, condone a full lockdown. Like, this country is too rebellious for that sort of thing. And I said this back in March, if we just closed everything down for like 2-3 weeks, really were diligent about wearing masks for the people who had to leave, we could have nipped this thing in the bud. It probably would have had a little bit of a spike later on, but we could have managed it with contact tracing and a bunch of stuff. But nobody's willing to do that. Like, nobody's really wanting to shut down their businesses. So because of that, when we do start to see shutdowns, what we're going to see is like piecemeal shutdowns, right? So we're going to shut down some restaurants. We're going to shut down, some like parts of the town, but other things are going to stay open. The reason why that's not going to work as much as it should is because our numbers have to be low enough to actually be able to contact trace after that. The epidemiological reasons for shutting down are to get the numbers to like less than 50 per 100,000. Right now, I think we're at like 300 per 100,000.
Wow.
We haven't gone below 100 per 100,000 this entire time. So, I think for like a couple of days we did.
So a solution, I think it needs to work hand in hand with government assistance and shutdown. A lot of people aren't shutting down because a lot of people lose jobs. Restaurants are shutting down in New York. There's a lot of New Yorkers that are going to be out of work. How are they going to pay their bills? And the people who are looking for their rent aren't going to, take, months off because they got to pay their mortgage. So, I'm just praying that this next bill has a little bit more relief and assistance to give people comfort to sit home for a month, 2 months, or 3 months, that whatever is needed, like, that should be comparable to the assistance. And for some reason, I don't know why.
You know why. Don't even start.
Yes, I do know why, but I just wish that would happen. Like in Canada, they're giving people like $2,000 a month. Like,
you have just been a, PSA for why you need to vote, right? Like, when people thought, like, what was the worst thing that could happen if we had, tomfoolery in the White House, it was this. Like, less people died in wars, right? it matters that we don't have to have governance that is able to function adequately. And so for a lot of people who are, don't want to take the vaccine, I mean, if you want to do anything, please vote. You know what I mean? Like, so yeah, so I don't know how we're going to make it work unless we are giving some form of subsidies and making it easy for people to shut down. But we do know that in the absence of that, we're going to continue to see these numbers of deaths kind of go up. And both situations are horrible. So,
I got a question for you, and then I would love to just hear if there's anything else you just want to share. So for some reason in Atlanta or Georgia, which is wide open right now, when you talk about the importance of elections, there's an election coming in January. Atlanta's wide open right now. Is the vaccine in the alcohol or the hookah or something, or we're just not hearing or seeing
yeah,
the numbers? Because it seems like nobody's wearing masks anywhere, but you don't really hear about it.
yeah,
Like, are the numbers spiking, or like what's going on? Because that just makes other people feel like, well, Atlanta's wide
exactly.
open and it doesn't exist. So I just wanted to get your thoughts on that, being that you're in it and you see it every day.
Yeah. Well, so the truth of the matter is the reason why you don't know that it's being spread is because we don't have the resources to even survey the places where we're spreading it, right? So nobody's at compounds, contact tracing the people, so what's going to end up happening, we're going to have people in the hospital, right? And then we've got to figure out who gave it to them. That's what contact tracing is, right?
Right.
But we don't even have there are too many cases for us to even do that. So my husband says this all the time. He's like, but people they're out and they're not getting it. Yes, they are. And they're spreading it. This is why all of the hospitals within Atlanta, the metro area, are at capacity, right? Like everybody, the doctors are definitely feeling it, right? The nurses are feeling it because the hospital system is being overrun. So if it wasn't being transmitted here, we wouldn't be seeing these high numbers. We had to shut all visitation down at all of the hospitals because the numbers are just too high. They're over 300, like I said, 300,000 cases, 300 cases per 100,000. We're over that number. We've been over that number for a couple of days. So the numbers are going up, but what people fail to realize is that if you're not on the website looking at the numbers, and if you're not in the hospital seeing the patients, you may not see it. You may not see it, because people are expecting maybe that, it's going to be like a movie and you're just going to be seeing people, die in the streets and just, foaming from the mouth. That's not what's happening, but we are seeing real disease in the hospital. And I'm starting to hear people that I know, like my grandmother passed, so my aunt passed, like it's starting to come home, getting closer to home. And so, I bet you there's a lot of people who know people and they're just waiting. This is the sad thing about how natural human nature is. We're waiting for it to hit our house before we realize that it's real.
Right. Is there anything that you want to share that we might not have touched on? Because shared a lot of information. We've been on for almost 2 hour, hour and a half, almost
Okay.
2 hours.
No, I mean, yeah, no, I mean, I think we covered everything. I'm trying to think if there was anything else that I wanted to say that I didn't get out, but no, I mean, we covered it all. All I would say is just listen, my goal here was not to convince you to take this vaccine. What I want as a physician, as a Black female physician, is I want two things. I want you to have informed consent. I want you to know, why you are or are not taking it. I don't want it to just be reflex that you're just not going to take it because. I want you to have some resources to say, this is why I'm not taking it. And then and actually have a reason, like an explanation,
Right.
And then the other reason is because, again, my grandmother couldn't be a doctor, but I am. And the reason I am is so that we can start to build trust within our communities. I am not a person who would normally like I was apprehensive about becoming vocal about this vaccine because I've been so, you know, protective of Black people and our need to be heard about why we don't trust the medical system. But the reason I'm speaking out now is because this is really serious, and we are the ones who are dying. We are the ones who are suffering. And if you don't realize that it's either we're going to continue suffering with coronavirus, or we're going to, you know, get this vaccine and start doing what we need to do. It's one, we've got to choose which one it is. And it just seems to me at this point, it seems to be a no-brainer for me, because I know the consequences, the risks are too high. So, you know, take it as you may, but ask questions. Please do not just assume that you know the answer if you have not really discussed it and thought it through with somebody who can bounce back. You know, you have your concern. Somebody needs to be able to give you some pushback, and then y'all need to come up with a solution. But don't just stay in your circle and everybody's saying, yo, that vaccine happened too quickly. They cut corners. It's not safe. People are going to end up with like brain damage because they got this coronavirus, and next year we're going to find them, you know, in a coma because they, like, don't sit in those circles and just keep talking that stuff. Like, find reputable sources, people that you trust, articles that you trust, and, you know, dig in before you make a decision as big as not taking this vaccine.
Yeah, so just for some who might have missed it when we covered it earlier, just to touch on really quick because it's very important. The side effects and long-term effects. Just the response, and just so people understand, like, we're still learning.
Yeah.
And there's still some answers that are gonna come.
Yeah.
But to your point, is weighing the risk. But if you could just touch on that, just so people can like just grasp it one more time before we head off, of, you know, the potential side effects and long-term effects. If you could just touch on that answer that you had.
Yeah. So I think I have to give that in two pieces: the side effects of the vaccine versus the side effects of getting coronavirus, because you have to, everything is a risk-benefit analysis. So the side effects that we know of the vaccine are going to be some of the same side effects that we see in other vaccines. There's going to be, you know, potentially swelling at the site of injection. There's fever. You might feel sort of malaise or fatigued and sort of ill initially. There have been some reports of anaphylaxis, meaning you have a large or a big immune response or allergic response that was seen once the vaccine was released. But the longer, so those are some of the short term. These things were tested. So in phase 3 trials, that we were able to find some of the short term side effects that you would expect to see in the first days and then first 6 weeks. So those have been tested in a fairly large size number of people. So those are some of the short term effects that we're going to see, versus the short term effects of corona are, let me say this. And now I thought of something I did want to say. I don't know any disease that does what this corona does this quickly. So the short-term effects are like detrimental. Like, you think about the flu kills people, but just not at this rate. You think of HIV, it can kill people, but not at this rate. Cancer can kill people, but not at this rate. They don't die this rapidly, and they don't die so many people at a short amount of time. So when we talk about the short-term effects of coronavirus, they are, you know, the worst case scenario is death. But then there are blood clots to the heart, blood clots to the brain, blood clots to the limbs, causing amputations, blood clots to the kidneys, causing kidney damage, lung disease, causing lung fibrosis and scarring, leading to long-term respiratory issues. So those are your comparative short-term effects. Long-term effects of the vaccine are still unknown, but they're the chances of having significant and frequent side effects, long-term side effects, are very small, particularly because of the way this vaccine was created, the type of vaccine it is, and the fact that most vaccines, even when you do have severe side effects, are very rare. You compare that to coronavirus, the long-term effects of that obviously all the things that I said. We have people who are now on permanent hemodialysis. We have people who have had strokes, have lost visions, have lost body parts. But we've also had people who got mild cases of corona and have long-term, or have had like 6 to 8 months and maybe longer, other issues like chronic pain, fatigue, and shortness of breath that last much longer than the immediate effect. So again, that's what we're weighing. It's not saying that we have all the answers. We just have to deal with what we know. And because what we know about coronavirus is so severe, it's so rapid, it's not something that I think we can wait on to see what the vaccine will do to decide to take action now.
Got it. Man, thank you so much, for your time. Time is the most valuable resource that we have. And this was very informative. There's a lot of information that was shared. So thank you for, getting on the platform and sharing this information, because I think a lot of people got some information that they can actually apply to make a decision when it comes, to that time. So
Yeah.
we really appreciate it, because trust is a big issue within the community. Like, that I'm not going to lie and act like it's not, trust. And I think the timing of everything is a cause of it as well.
Yeah.
From leadership in the White House to pre-existing thoughts of trust, you put all that together right now, and then the speed of which the vaccine has come about, which you talked about, the reason why we were able to process this a little bit faster. You put all that together, and people and not having, the right people to share content and information, or, platforms like this for them to have access to, you just have a whole lot of misinformed people who just, they're going to base their decision off trust.
Right.
If anything, if they don't have the information, I have to trust that these people are going to give me something that's going to be a benefit to me. And there's no trust.
We don't trust, and I don't blame anybody. It is on the establishment. It is on the medical establishment to prove themselves trustworthy. It is not on us to just blindly trust. Right. And so I'm a big proponent of that. I'm definitely on that camp where I believe that my role as a physician is to try to fill the gap. And I promise you, I wouldn't be on here talking about this stuff if I didn't believe what I was saying. I love us. I love what we bring, and I don't want to see us become, a victim to not having people out there speaking on our behalf. I just hope that, if anything, you people who listen to this will recognize that, I'm not out here trying to push, somebody else's narrative on you. I'm just telling you what I know, telling you what I researched for my own family, and hope that, you'll take that with some sense of, pride that, we can represent ourselves and we can protect ourselves.
Yeah, and I think you said something that was very important, is the ability to fill in those gaps. And I think more people like yourself who come about and actually share their thoughts, to share, because like you said, it's bigger than just trying to push a narrative.
Yeah.
You're trying to find the best decision to protect your family and the people you love. And when a message is coming from love, then that it lowers, that wall of distrust, understanding that, this is bigger. Like, you have to make a decision personally for yourself and your family. So I think the more people that can come in and fill in that gap of trust and just share their thoughts, their insights, definitely is important. So you coming on the platform was very important today. So thank you.
I appreciate it. Thanks for having me.
Thank you, everybody, for tapping in. I will save this and repost it so you can rewatch if you missed the beginning parts of this. A lot of information was shared. Thank you again, and all have a good night.
Good night.